As a teacher, I get sick a lot too. Like I've gotten so many different things over the years, not just colds, but strep throat, and I had pink eye one year.
This school year, though, Jessica Deacher hasn't had to call in sick once.
This year has been much healthier, I would say, just in terms of like the flu and colds and stuff like that.
No.
She's not the only one noticing how less socialization, wearing masks, and the constant hand washing is making a difference when it comes to the seasonal flu. Doctors are also crediting an uptick in the seasonal flu vaccine.
Being inside a lot has its downsides, but I guess these are the upsides.
And the evidence backs up what people are experiencing. The BC Centre of Disease Control says that it did around 30,000 tests on samples for influenza so far this flu season and only came up with around a dozen positive cases. Compare that to the flu season of 2019-2020. There were 861 positive tests and around 1/3 of the testing done.
We've tested more than 4 times as many specimens since September this year as we have in typically on average in the past 5 seasons. So we are trying to find that virus, but so far nothing.
And that has translated into having the resources and capacity for doctors to better focus on COVID-19.
Can you imagine, with all the stressors that we have with COVID-19 in our hospitals, if we had to add influenza to that? It would be disastrous. I mean, we would have buckled long ago.
It's made a difference in long-term care homes, too. There were 19 seasonal flu outbreaks in the facilities last year. This flu season, 0. Dr. Jawanda hopes that some of the pandemic practices that are now social norms will continue into a post-pandemic flu season.
We obviously talk about washing your hands and not, coughing into your sleeve like we tell all our kids. But when you actually see the stats, it's remarkable, like, wow, it works.
And will hopefully make a difference in flu seasons to come. Megan Batchelor, CBC News, Vancouver.